Hi everyone there. I'm welcoming you to Kate's Health Talk, and today we are going to have a very nice discussion about fracture. What are you supposed to do if in case you have a broken bone or a crack on your bone? A fracture simply means a broken bone or a crack on your bone. So there are several types of fracture. Different types of fracture that we have are a complete fracture or an incomplete fracture. Complete fracture means that the bone has completely broken. An incomplete fracture means that the bone is not completely broken. We may have also open fracture and closed fracture. An open fracture is whereby the bone has broken and has also gone ahead to tear the skin. A closed fracture is that broken bone that has not broken the skin. A simple fracture simply means it's just a simple broken bone. A compound fracture means it's a broken bone with some pieces around the bone. There's another type known as comminuted fracture. Comminuted fracture is a broken bone whereby you can see some pieces of the bone. There's a green stick fracture. This whereby you have one side of the bone is broken. Transverse fracture, it just goes transverse, a bone that is broken in a transverse way. Oblique fracture is a bone that has broken in oblique position. Pathological type of fracture is where a condition, or you may have an existing condition or illness that may lead you to have a fracture or a broken bone. Intra-articular type of fracture is a broken bone that is near the joint. A green stick fracture is a fracture that is on one side. Causes of fracture or causes of a broken bone. Like I've just said before, you may have an underlying condition or an illness that can make you have a fracture. Also, road traffic accident. When people go through road traffic accident, they end up getting broken bones. Overuse of bone, like athletics, they may end up getting fracture. What are symptoms of a fracture or a broken bone? 1, you may have pain. 2, you may have loss of function. 3, you may have swelling around the area that there is a fracture. 4, you may have bleeding, and this bleeding can make you have anemia or decrease in the blood. 4, there is deformity. You see, like the hand or the leg is bent. Also, you may have paleness. When you check the palm of your hands, you find that they are pale, like paper white. You may also feel dizziness. This is simply because you have lost blood. For example, in an open fracture. There is also difficulty in walking or difficult in using the hand or the leg. There is also loss of height or shortness of the limb. For example, if it's a broken femur, when you put them together, the leg that is having fracture tends to be shorter than the other one. In case you have a fracture or in case you see someone has a broken bone, the very first immediate thing you do is tying that hand. You're supposed to tie that hand or that leg using either a rolling stick or a mwiko. This will help in immobilizing the hand so that the bones inside will not move and make injuries to the surrounding tissues. Another thing you're supposed to do is apply ice packs. By application of ice packs around that place where there is fracture, you are reducing pain to that person. Another thing you're supposed to do is apply pressure just near the place where there is bleed. To use something that is wide, can be either a bed sheet, as long as you apply pressure on the hand so that you may reduce bleeding. Then immediately take the person to the hospital. And lifting that person, for example, if it's a leg that is broken, you're supposed to pull it towards you and away from the patient in order to prevent injuries around the area where there is fracture. As soon as you get to the hospital, there are different things that happens to your patient or to you if you have a fracture. You'll be given a painkiller by the doctor. Number 2, the doctor will send you for an X-ray or a CT scan or MRI depending on the level of your fracture. Number 3, now he will start managing the fracture according to the types and different types of fracture. You may find out that the doctor can use traction. This will stretch the muscles and tendons around bone. Traction simply means using weight to pull your leg. Right? For example, there are people who have been admitted to the hospital, and instead of doing a surgery, there is a weight that is applied on your leg to make sure that the bone is aligned properly. Also, surgery can be used to manage your fracture depending on the type of the fracture that you have. Normally, they use abbreviation known as ORIF. ORIF means open reduction and internal fixation, using screws or metals or rods to keep the bone from moving. External fixation is whereby unapata mtu ako na chuma kwa mkono ama kwa mguu, unaziona hizo chuma, unaziona. ORIF is internal fixation. Hizo chuma hauwezi ziona, hizo screw hauwezi ziona. Lakini external fixation, you can see the pins, the screws that go into the bone above and below the fracture site. On top of a painkiller, you are also given antibiotics. This is to prevent you or prevent your bone from getting infection. Also, the doctor encourages you to go for physiotherapy. It is important in helping to return to your normal activities. Another thing that you're not supposed to forget is to take a balanced diet. For example, protein will help in bodybuilding, starch will help in energy giving, and also vitamins will help in boosting your immunity. Remember, follow up clinic and drug compliance, a balanced diet, and more so, please do not lift any heavy weight as long as you have a fracture, as long as the fracture has not healed. This is simply because you can have another fracture recurring. Therefore, it's advisable not to lift anything. I hope I've taken you through and you have learned something new that you did not know in managing fracture. So next time, till we meet here again, you're going to learn much more. You're more welcome. Goodbye.